All right, everyone, this is the dynamic, amazing traction roll. All right, this is to regain the lost arc that we have on our neck and shoulders. This is one of the best exercises that you can possibly do to help preserve the spinal cord, open up and regenerate those discs, and to get that head posture in a positive, ideal position. So, first and foremost, do not use this unless you are consulted with a corrective chiropractic physician. They have taken x-rays. They know what your cervical spine or your neck looks like, so we know exactly where to put this so we're gonna get the best response possible, okay? That is very, very important. So we know what Laura's spine looks like. What we're gonna do is we're gonna place this traction roll, and it's dummy proof. It says shoulders to this side, so that's where we're gonna put it. And what we're gonna do is we're gonna lay her on her back with this traction roll, and her neck is going to extend past the traction roll. Now what this is gonna do is it's actually gonna open up the discs from the front to help to restore what we've lost within that curve and within those discs, okay? So let me demonstrate. Let's say that we've lost something in the lower neck area, and that's very, very typical of people. What we're gonna do is we're gonna lay this traction roll right below that so that we can extend those discs the most so we can get those nutrients and those blood flow into the discs and to relax those muscles, okay? So she's gonna start out on her back, she's gonna lay back, and I'm gonna help her out. We're gonna position this right there. Her neck's gonna keep going back, and that's it. And she's just gonna lay just like this, all right? Now, as you can see, it's really accentuating the curvature. Now, for some people, especially people that have lost the curve or have a reversed curve, I'm gonna help her up now. Thank you so much. This can be very painful because we're trying to re-educate the muscles and the joints and the discs in a way that is pretty aggressive. So we don't start out doing it for 10 minutes, 12 minutes, or anything beyond that. We're gonna start out doing it for maybe 30 seconds, maybe a minute, something that's comfortable as much as you can. If you do this and you start to have pain, dizziness, headache, radiating symptoms, again, stop, this is inappropriate. However, the more you start to do this on a daily basis, you're gonna start to re-educate and you're gonna be able to do this for a longer period of time. Again, we need to be able to get you to a point where we are doing this for 18 minutes a day. Once we do that, we are literally able to change the structures of the neck and shoulders long term so that we can survive with the neck and shoulders where it should be for the rest of your life. Now, again, if we're starting out for 1 minute, we're gonna progress through each and every day, getting to 18 minutes. That is ideal. Again, take your time. I tell people just do it on the days that you wanna feel good. So on a daily basis, you don't have to do this forever. Once you re-educate, you're good to go, all right? So it might only take you a couple months, but then you've restored the curve, and wow, that is just a fantastic thing for the neck, the shoulders, and for your health.